Obesity. It's been overshadowed by the pandemic, by the COVID pandemic, but the numbers are staggering and they continue to climb. Plus, the disease has been linked to serious health problems and has been called a major public health crisis. So what are the causes and what can be done to reverse this trend? Today, we'll have those answers for you and questions and your health questions right here on Dr. Q&A. Obesity is a problem that continues to get worse, not only here at home, but across the globe. The latest numbers from the Centers for Disease Control and Prevention are alarming. Take a look at this. In 2017 through 2018, over 42% of American adults were considered obese. That's an increase of over 10% from 1999. The estimated cost of obesity in the United States was $147 billion in 2008. And that year, obese people paid $1,400 more in medical costs than average weight people. So today, we are joined by a very special expert, Dr. Meredith Duke, an assistant professor in the Division of General Surgery at Vanderbilt University. Welcome, Dr. Duke.
Thank you so much for having me.
Thanks for being here, especially to talk about something that is so important. Before we start, Dr. Duke, I do want to let our viewers know that if they have a question for our expert, all you have to do is give us a call or email that question. Email questions to questions@allhealthtv.com. Give us a call, 855-796-4475. You can even use your cell phone and send it to us via your cell phone right there on our website, AllHealthTV.com. So Dr. Duke, let me start with something that I've heard many, many times, and maybe you can explain this. Obesity isn't a pandemic. It's usually been called an epidemic. So what is the difference and why is it referred that way?
So an epidemic is a disease that's rapidly increasing in prevalence or incidence. And so obesity falls into the epidemic category in that the percentage of our population that was obese has increased at exponential rates over the last 50 years.
And what would you say is the difference then between obesity and then just simply being overweight?
So we use a metric called the BMI to determine somebody's healthfulness in regards to weight. So the BMI is the body mass index, and it's a measurement of weight in kilograms divided by height in square meters. And so a normal BMI ranges from 18 to 25. The overweight category is 25 to 30. And then class 1 obesity is 30 to 35. Class 2 obesity is 35 to 40. And class 3 obesity is a BMI greater than 40.
And when the term obesity is used, doctors refer to it as a disease, not just like a lifestyle issue. Why is that?
So that's a great question. There's a lot of stigma around obesity. There's this misconception that is a choice or lack of self-control that leads to obesity. And it is a chronic disease. It's multifactorial, much of which is genetic, heritable traits, how you respond to overfeeding, underfeeding, metabolism, so many other things that are not easily controlled by a simple equation of calories in minus calories out.
So would it be correct to say that maybe race or ethnicity plays a role here, doctor, whether one is born obese in terms of just developing that in their life?
Absolutely. Obesity is certainly increased in different populations. Our non-Hispanic Black population has one of the highest prevalences of obesity. And this is definitely associated, again, with heritable factors that contribute to this.
And what about income and education? Does that play a role as well? Because obviously there's a lot of factors here.
The incidence of obesity is much higher in our lower socioeconomic statuses. That can be lack of access to affordable, healthy food options, under housing, multiple different factors, as well as lower levels of education that are associated with obesity.
All right. And doctor, before we continue our conversation, I do want to remind our viewers that if you have a question for our expert, it's again very easy to just send it in. You can give us a call to 855-796-4475, or you can send your question to our email, questions@allhealthtv.com. And you can also record your question on your cell phone. We'd love to see you ask the question and send it to us through our website, allhealthtv.com. So doctor, speaking of questions, I have a viewer question here from Ross, and let's take that and see what he has to say. I remember growing up that when someone was overweight or obese, people would say that person has the fat gene. Is there really a fat gene? Doctor, what are your thoughts on this one?
There is no one single fat gene, if you will. It is, again, multifactorial, and we've identified greater than 500 adiposity-related trait genetic loci, which means that, again, how your body responds to the calories that you put into it, the energy expenditure, all of that is
no worries, doctor. It happens to me. That's why I always have water right here waiting for me.
It's definitely genetic, but it's not a singular gene that we can control.
Okay, but when one refers to that, because I've heard it as well in the past, and I personally don't like the way they say fat gene, but again, if a mom and dad are obese, does that guarantee that the children will be also because of just the genetic disposition?
So we do find that obesity, as well as the obesity-related comorbidities, do run in families. And so a family history of obesity, diabetes, hypertension, cardiovascular disease, all of those can run in families. So yes, having parents that are obese can predict obesity of their offspring.
And I'm really glad Ross asked that question, and I really appreciate it, Ross, because I find that I have a friend of mine who has two parents that are obese, and she spent most of her life, doctor, if not all of her life, always trying to take care of herself because she always felt that she was going to have that predisposition. So is that something that one can do when they're younger to say, okay, I know I have to be healthy. I know I have to do exercise. I know it's all about lifestyle, but because my two parents were obese, I really need to make I guess, more of an effort, if you will?
So yeah, absolutely. Childhood obesity is definitely a predictor of adulthood obesity. And so this is one of the focuses of management of obesity, is trying to have early interventions to avoid the chronic nature of obesity as well as the comorbidities. And so instilling a healthy lifestyle, diet, all of those things are important to prevent obesity.
And I'm glad you brought up childhood obesity, because I sometimes wonder what is going on. The numbers are staggering. More and more children are overweight. Is it the social media? Is it the lack of exercise? Is it all of the above? Because as a kid, I remember we were always outside playing and doing things. And now kids are just on their phones and Instagram and, well, you know, doctor.
So it's definitely concerning that we have so much more of a sedentary lifestyle, which certainly contributes to, weight and having obesity. But it's not just that simple that we are sitting down more, and so we are more obese in society. There definitely have been some changes to our diet, the way that we process foods, the hormones that are within foods, and so much research is happening to try and determine what component of obesity is related to diet, what is related to exercise, what is related to metabolism and neuroendocrine responses to your diet.
And doctor, how does diet and lifestyle play a role then into someone becoming obese?
So when you look at diet and lifestyle, or diet and exercise, diet definitely contributes more to your weight than exercise. Certainly part of a healthy lifestyle is having routine, frequent exercise and activity within your life, but wanting to lose weight, and diet is going to be more contributory to losing weight than exercise alone.
And doctor, let's talk about other major health concerns that can happen if one is obese. What are the most dangerous? I know there's many, but can you list some of them for us? That would be maybe the top three.
Sure. So I would say cardiovascular disease, diabetes, and hypertension.
All right. And how do those develop over time? What happens?
So your body develops what is called insulin resistance with the excess adiposity that's carried with obesity, and your body starts losing the normal ability to metabolize and utilize glucose within your blood sugar. And ultimately, the disease of type 2 diabetes can and will develop over time. And diabetes as well as obesity can contribute to both cardiovascular disease as well as hypertension. Obesity is an inflammatory state, and so the way that your body, again, metabolizes glucose, deposits plaque, chronic stress of hypertension on your blood vessels can all contribute to these different comorbidities, significant morbidity and mortality. Patients.
And doctor, since we're talking about childhood obesity, I'd like to go to a new video from the World Obesity Federation that talks to children and young adults about this disease. This is really important. Let's take a look. Doctor, looking at that, I was really happy to see the awareness. And I think that's something that we need more of when it comes to obesity. I just don't think it's at the forefront, especially with younger kids, teenagers, younger adults.
I couldn't agree with you more. I really appreciate that video, and particularly the highlight of the lack of control that individuals actually have around the factors around them. And we as a society need to help make changes.
We really do. I want to go to a question now. We have a question from a viewer, and his name is Keith. Let's take that and see what he wants to know, doctor. And as we queue it up, my doctor wants me to get bariatric surgery, but I'm afraid to do it. What are the risks involved? And will I have a lot of loose skin afterwards? Doctor, before we answer Keith's question, can you first explain what bariatric surgery is for our viewers and then chime in on what his concern is, please?
Sure. So bariatric surgery is typically performed in the United States minimally invasively or laparoscopically. So we do the surgery through very small incisions, usually 5 or 6 incisions that are very small. And typically there are two of the most common procedures that are performed today. One is a sleeve gastrectomy and the other one is a gastric bypass. In a sleeve gastrectomy, we remove around 80 to 85% of the volume of the stomach and we remove it permanently. And that's considered to be a restrictive procedure, which means you can eat less volume. That's a more simplified answer than what's really going on. It also affects the hormonal response to eating as well as your metabolism, which is probably the more important effect on your weight and the comorbidities with obesity. The other procedure is called a gastric bypass. It's the classic bariatric surgery that's been performed for decades. In this procedure, we take the normal stomach and we make it into a small pouch. And then we divide the intestines and bring them to a small pouch. So when you eat food, it goes down your esophagus into the very small pouch, and then it travels immediately into the intestine. It bypasses the digestive enzymes that are secreted into the small bowel from the pancreas as well as the gallbladder. And with this procedure, it's considered to be restrictive as well as malabsorptive. So the diet that you are eating, not as much of it is being actively absorbed. It also has a very strong hormonal or metabolic effect on your body that we are doing research on every day to try and understand the implications of these changes in response to surgery.
And to answer Keith's question, he asks, will I have a lot of loose skin afterwards? What is your response there? I hear that from a lot of people too, that they worry about that.
So this is a great question. Many of my patients ask this exact same question. And the answer is you may have loose skin. There are patients who lose up to 60 to 70% on average of their excess body weight, and the result can be loose skin. The response to that, to completely treat it, is plastic surgery to remove the skin. But the ultimate decision whether or not you need surgery is very much a personal one. And I have many, many patients who have large amounts of loose skin that have no desire to have additional surgery. Many patients don't have as much loose skin. Typically younger women that have a little bit more elasticity within their skin sometimes have less of the loose skin. Some patients have a very small amount that bothers them and they choose to have surgery to address it. Again, it's a personal decision whether or not you want to address what loose skin you have. But I ask my patients when they're a year outside of surgery if they have any regrets or if there was anything they wish they would have done otherwise, knowing what they know now. And 90% of them say to me they wish they would have done surgeries too.
Look at that. Speaking of surgery, doctor, we have a question from Sasha from YouTube, and here it is. Hi, guys. I was wondering if you could tell me about minimally invasive surgery through the belly button. Is there a lot of pain? Does your belly button hurt, feel the same after the procedure, look the same? Great question, Sasha. Doctor?
So there are two different types of minimally invasive surgery that can be performed. One of them is called laparoscopic surgery, and one of them is robotic surgery. We don't typically do single site, so just through the umbilicus. Laparoscopic surgery or really robotic surgery, we typically use multiple small incisions. And when I say small, they're usually between 0.5 centimeter to about 1.2 centimeters in size. And these little incisions, some of them that are larger, so 1.2 centimeters, end up getting closed with stitches well underneath the skin, deeper in the muscular layer. They can be tender when they're healing, but once the tissue is completely healed and the skin is closed, they can be hardly noticeable, whether it be hidden within your belly button or in other locations around your abdomen.
All right, doctor. I actually want to talk about obesity now, if you don't mind, and the COVID-19, because there seems to be more risks with people who are obese. And we have a full screen to show you. This is from researchers at Johns Hopkins University and the World Health Organization. And here it is. The risk of death from COVID-19 is about 10 times higher in countries where most of the population is overweight. So a couple questions that I'd like to ask you, doctor. Why is that? Why are there more risks involved?
So having obesity is certainly associated with poorer outcomes with COVID infection as well as hospitalization. And the reason why is the physiologic changes that obesity causes to the body. So lung ventilation can be made more difficult due to the increased mass and the decreased volume with ventilation. Obesity is also an inflammatory state, so it's a hypercoagulable, which means that your risk of having blood clots is higher just related to obesity. And COVID is known to have significant clotting disorders as well, and so this combination can portend particularly poor outcome. You can also have altered glucose metabolism, which is also associated with poor outcomes. So obesity tends to affect pretty much every system in our body, and COVID does the same. And so these negative effects compound one another.
All right, just to remind our viewers, if you have a question for our expert here on Dr. Q&A, you can email us that question. Send your questions to questions@allhealthtv.com. Give us a call at 855-796-4475, or you can go straight through our website, which is there to your right, lower right-hand side, allhealthtv.com. Doctor, I know one of your passions is working with obese women who hope to get pregnant, which I think is wonderful. First, tell me about your passion and how you help them and why it's difficult for them to get pregnant. Lots of questions there. My apologies.
It's okay. This is definitely a topic that I enjoy talking about. I myself am a mother and actually just recently gave birth to our fourth son. So we have an 8-week-old at home right now. And I absolutely love the ability to be a mother. And there is nothing more satisfying in my job than being able to help other women that would like to achieve this goal. So many women that have obesity also have what is called PCOS, or polycystic ovarian syndrome. And that's a disease that's related to abnormal hormonal responses that can contribute to infertility. And bariatric surgery is one of the best and really only cures for PCOS. And so women that have undergone bariatric surgery have significant increases in their fertility. So up to 70% of women that were not having normal periods before surgery can start developing normal periods. And I can tell you of many patients of mine who struggled to become pregnant before surgery and have gone on to have very healthy and satisfying pregnancies. And I'm very blessed when patients send birth announcements, make a special trip to let me know their exciting news. I'm incredibly happy for them and make this dream come true.
Oh, that's so fantastic, doctor. And speaking of pregnant women, and since we are in a pandemic, I do want to take this package real quick. It's a COVID-19 segment on pregnant women and getting vaccines. Let's take a look at it real quick.
The CDC is now recommending the COVID-19 vaccine to those who are pregnant. A new study found no evidence the vaccine causes safety concerns for the mother or the baby. There's also evidence the vaccine is important for those who are breastfeeding as well.
My daughter-in-law is breastfeeding, and I recommend that she be vaccinated because now we have very good data that not only protects her, but actually the breast milk, she can pass antibodies to the baby through the breast milk, and there's very good evidence that offers protection. So I can see a lot of benefits of vaccination.
The consequences of COVID infection during pregnancy can be very severe and include a higher risk of complications and death for both the mother and the child.
And I'm glad we got that in, doctor, because there's been a lot of concern. Your reaction to this?
So I think I'm an excellent expert to ask because I do have a strong opinion on the matter. I was able to consult some of our experts in immunology as well as our OBGYNs here at Vanderbilt University, and the recommendation was very clear. The risk of the COVID vaccine, even early on, was felt to be outweighed by the potential benefit to being or having some degree of immunity to COVID versus contracting COVID while pregnant. So I was actually one of the first healthcare workers immunized, and I was 26 and 29 weeks pregnant when I received the vaccine. And I hope that I'm able to continue to confer some immunity to the little one now by breastfeeding. And I also am happy to answer questions that others may have and encourage them to have faith in the science and the vaccination in women.
And doctor, that makes such a difference when not only are you the doctor speaking to your patient, but also you are indeed the patient, letting them know, hey, I was there. I'm sure your patients are so happy when they're able to have that one-on-one with you.
Absolutely. I do think it certainly shows some degree of trust. And to throw another little supporter in here, I just got my 14-year-old vaccinated last week now that it's been approved for that age range. And I would encourage that as well.
And I got my 16 and 18-year-old as well. Doctor, thank you so much for your time. Before we leave you, what is the name of your newborn, the 8-week-old boy?
So we have Campbell Duke as our newest family member.
Is he sleeping?
He is wonderful. When you're the fourth, you don't really have a choice. So yes, we're very blessed.
True.
He's a great sleeper. Thank you for asking.
Doctor, thank you so much for your time. You're obviously very busy. You have a little league team, a full-time job. God bless you. Thank you for what you do.
Thank you.
You take care. Hopefully we'll see you next time on Dr. Q&A.
Bye-bye.
Bye-bye. And to our viewers, thank you so much for joining us today, especially on this important topic of obesity. I'm Olga Villaverde. We hope to see you next time right here on Dr. Q&A. You be safe.
The Health Channel wants you to have all the answers you need to be in control of your health.
Infection and the virus keeps coming back.
That's why, in addition to Dr. Q&A,
if treated appropriately, the patient should.
You can always chat with one of our health advisors through our free service, Ask Hannah. Just go to allhealthtv.com or download the Health Channel app and get the answers you need.
No question should ever be left unanswered. Remember, if you don't know where to start, ask Hannah.